Can you hear it?
Hi, everybody, and welcome to the Pacific Islander of Health Board Washington's Facebook Live about Washington Apple Health. My name is Mia McFarland. I'm the program manager, and with me today is the whole team that I'm going to have introduce themselves. And I'll go ahead and start with Ariel if we can.
Thank you, Mia. My name is Ariel Pertek. I'm with the Healthcare Authority in Medicaid Eligibility Policy. Thank you.
All right, thank you. Then I'll pass it to Roz.
Half a day, Roz Leon Guerrero. I'm with the Healthcare Authority. Pronouns are she, her.
That's a good point. Pronouns are important. And then I'll pass it to Diela.
Hello, everyone. My name is Diala Ueki. I am one of the healthcare navigators with the Pacific Islander Health Board of Washington. Ali ang klaka Diala Ueki, ang katara navigator, L'Oreal Lomingela Pacific Islander Health Board of Washington.
All right, thank you. And then I'll pass it to Renza.
Hello, my name is
Thank you. And then I'll pass it to Clara.
Hello, my name is Clara. I'm from YAP. I work with the Pacific Islander Health Board of Washington, a YAPI's navigator.
Thank you. And then unfortunately, we're missing Alinda today, but Alinda is our Marshallese navigator and outreach coordinator. Hi, Alinda, if you're watching. And then I'll pass it over to Diela for our presentation today.
Thank you, Mia. Ali and hello, everyone. Welcome to our second educational presentation. Today we'll be focusing on Washington Apple Health. As a quick overview, we'll be going over why healthcare coverage is important to have, what is Kofa, what is Apple Health. We'll also be going over eligibility requirements for Apple Health. We will have some time for any question folks might have towards the end. And before we wrap up, we'll provide some resources as well as a survey for anyone wanting to provide feedback on today's presentation. Why do you need healthcare coverage? Healthcare coverage provides financial protection in case you have any serious accident or illness. For example, a broken leg can cost up to $7,500. Health coverage may protect you from high unexpected costs. Also, healthcare coverage will cover COVID testing and illness. When you go to the clinic, a visit can be around $250 to be treated without insurance. With coverage, you'll get access to preventative services like shots and screening tests at no cost to you. Getting recommended preventative services is a key step to good health and well-being. What is Kofa? The Compact of Free Association, also known as Kofa, is an international agreement establishing and governing the relationships of free association between the United States and the 3 Pacific Islands, sovereign states of the Federated States of Micronesia, the Republic of the Marshall Islands, and the Republic of Palau.
All right, Clara? Oh, you're on mute. Hold on. Here we go.
Insurance terms. Copay is a fixed out-of-pocket amount paid by an insurer for covered service. Deductible is the amount of money that the insured person must pay before an insurance company will pay a claim. Out-of-pocket expenses are expenses for medical care that aren't reimbursed by insurance. Premium is the amount of money an individual must pay for an insurance policy.
And these are all terms that'll come up throughout the presentation.
What is Apple Health? Apple Health provides care to over 2 million Washington residents, including pregnant individuals, children, and adults. Apple Health provides medical, vision, dental benefits, and health care services such as preventative care, cancer screenings, treatment for diabetes and high blood pressure, and many other healthcare services. There are no co-payments, deductibles, and other out-of-pocket expenses. What does Apple Health cover? Appointment with a doctor or healthcare professional for necessary care, medical care in an emergency, maternity and newborn care, mental health services, treatment for chemical or alcohol dependence, pediatric services, including dental and vision care, limited dental and vision care for adults, prescription medications, laboratory services, hospitalization, transportation to and from medical appointments when necessary, an interpreter for your appointment if you do not speak English. It will be arranged through your provider. COVID testing and vaccination.
Eligibility requirements. Apple Health requirements. An application is required to determine if an individual is eligible for Apple Health Medicaid. Most individuals eligible for Apple Health apply for coverage online at wahealthplanfinder.org. Kofa Islanders must meet all eligibility criteria for Apple Health, including income limits, Social Security number requirements, and Washington residency. Income verification may be required before eligibility for Apple Health is determined. If proof of income is required, individuals will receive a notice with the request.
Okay. Renza?
Classic Apple Health refers to programs administered by the Department of Social and Health Services, which known as DSHs. Individuals who are age 65 years old, have blindness or disability, or need long-term services and supports. Apply for Apple Health coverage online at washingtonconnection.org or call TSHs or submit a paper application. Eligibility factor varies for each program is based on household size, income, and resources. Apple Health for non-citizens. Alien emergency medical is covered for individuals who do not meet citizenship or immigration status requirements, or for qualified individuals who have not met the 5 years immigration bar and have a qualifying medical condition. A qualifying emergent medical condition such as emergency room care, inpatient hospitals admission, or outpatient hospital surgery. A cancer treatment plan, dialysis treatment, anti rejection medication for non organ transplant, long term care services by approval required, COVID 19 assessment and testing. What is what is the most I can make per month to qualify? These are the income eligibility requirements. Apple Health for pregnant people. Apple Health for pregnancy provides coverage to pregnant people with con- count- countable income at the below 198% of the federal poverty levels without regard to citizenship or immigration status. This chart this chart shows the most a client can make depending on household size to qualify for Apple Health for pregnant women. Apple Health for kids. Children's coverage may be free or no cost, with a no premium if income is at or low below the Medicaid standard. This chart shows the most a client can make depending on household size to qualifying for Apple Health for kids. This is showing the table combined 2021 income eligibility table combined from previous slides. This table can be filled at www.hca.wa.gov as free or low cost.
Yeah, and then there's also if you have more than 8 people in your household, for adults you would add an additional adult, you would add $500 down at the bottom. It'll tell you how much you can add to your maximum income limit. And so that's just a brief overview of both the income requirements and some of the things that you need some of the requirements to have Apple Health insurance, and so how to apply or make changes. So our team is able to help with applying for Apple Health, renewing your coverage, updating contact information like address, email, and phone number, or any questions you have about your account or application. And we actually just had this discussion this morning that if you don't have the correct address linked to your insurance or your most updated address, sometimes pharmacies won't give you your prescription. So it's incredibly important to have all of that information updated so that if there are any problems or concerns that come up, that they can get in touch with you, and also so that you can pick up your prescriptions in a timely manner. And so how do you get in touch with our PIHB navigators? So you can schedule an appointment at pihb.org/Kofa Health to meet us on Zoom, or you can call our toll-free line at 888-308-7113. And this is staffed by our PIHB team, and interpreters are available in Chuukese, Costa Rican, Marshallese, Palauan, Pohnpeian, and Yapese, which part of the team is here today, and that's who will be picking up the phones. And then what you need to apply for insurance, so you should bring this with you, is name, date of birth, and home address, information about your household, so that same basic information, the name of each person in your household, their date of birth, and ideally they'll all have the same address as you because they're in their household. Your social security number, any immigration documents such as passports, I-94 numbers, and other documents, information on how you file your taxes, and your employer and income information, because they'll ask for employer details such as the address of your employer, and if you have any other jobs. All right, so now we'll see if there's any questions. That was an incredibly quick presentation, but we'll leave some time for questions. In the meantime, does our team have any questions? We had a good question come up earlier. Oh, okay. Actually, Ariel had a good one. Would you like to let everybody know about that?
Yeah, so I was just looking at what you need to bring, and so we have employer and income information, but income doesn't necessarily just mean from your job. So there are other types of income that we count when you apply for Apple Health. And one of those, I'll just give an example, is Social Security or pension benefits. And that could be from here in the US or from back home that you're receiving now when you live here in Washington. So that's one thing. And so one of the great things about Washington Health Plan Finder is it will take you through, and the team here on Facebook here can do this with you, is it will take you through the questions. Do you have this type of income? Yes or no. Do you have this type of income? So one of them is, Social Security or pension benefits.
Thank you. That's a good one. Okay, we do have a question. So this question says, it's been more than a month and I haven't received any cards. And if my team, let me even pull this up. So on our website, this will be an interesting one. Let me click ahead. On our website, we do have the link to that. No, I think it was back. There we go. pihealthboard.org/kofa-islander-outreach-information. And let me go to it because it has, let me share my screen, some of those resources, including what happens if you don't have your card. Can everybody see this?
I cannot.
Oh, interesting. Oh, there it is. Okay. Ooh. Okay. How about now?
Yeah.
Okay, great. So in case you have lost or not received your Provider One Services card, you would call the toll-free line at 1-800-562-3022, and they can help you out. If you have either lost or not received your Managed Care Plan Services card, you would have to call your health plan. So all those numbers are listed on our page. But we have AmeriGroup here, Community Health Plan of Washington, Coordinated Care, Molina, and United Healthcare. If you are not sure which insurance you have because you at the time like you heard a name and you're not really sure, you can actually call our toll-free line and we can look that information up for you. How do you stop sharing? Here it is. That was weird.
That's a good little mind trip
I was
there.
like, okay. But yeah, so that's on the website, but I also can pop that in the chat really quick. And then the number to call us is 888-308-7113 if you need help doing that. All right. All right. Any other questions? Or if our team has any good questions?
Mia, could you all explain if a person calls through the toll-free line, what services they would get, like interpreter or interpretive services, translators, and how would they access those for their respective Kofa language?
Oh, yeah. Actually, could we start? I know, Renza, you've gotten calls through the line. Could you kind of tell what you've been helping folks with when they call in?
I help folks enroll for the Apple Health Insurance to them calling that number, and it goes straight to my phone when they say for two keys press the number, and then I answer it on my phone.
Yeah. So like earlier, we can do. Oh, where'd it go? There we go. So we can do the sessions over Zoom, or we can help people apply for Apple Health over the phone. That's a possibility. We can also update contact information or just answer any questions you have about Apple Health or your account or your application. And so the Renz is right. So you call into the number and it'll ask you to press 1 for the Kofa program. And so once you press 1, then it'll read through a list of like press 1 for Chuukese, press 2 for Marshallese, and then you just click whichever phone number you would like. Or you can even like, I think I'm the last number on there if you are comfortable speaking English, or you can connect to any of the interpreters or navigators depending on who's free. So we're very reachable, and we're running that line 9 a.m. to 6 p.m. Monday through Friday. Okay, there's actually one question that I might ask Ariel and Roz to take. And it's what happens if I have a discrepancy on my name, on my social security number, and my I-94, like if I get married or change my last name.
So, well, let's see. So, in what I can talk to is regarding applying for Apple Health. And so, what we need is for you could get a name discrepancy if you type in your new name and your social security card has your old name. So there might be more information that might be needed because then the system can't um, verify that information. And so you would need to make sure that the Social Security Administration has your current name. And if we ask for your I-94 because we need to verify your immigration status, um, send in what you have, but you might need to talk to um, the USCIS as well. Again, I-94 is not the only required immigration document in Washington Health Plan Finder. You can also submit your foreign passport, or some people have employment authorization cards or permanent resident cards. Whatever you have, submit that into Health Plan Finder, enter that information in. If you are a dual citizen, so you are a US citizen and a Kofa Islander, you would not enter your I-94 or foreign passport. You would say you are a US citizen.
Awesome. Thank you. That's a good answer. All right. And then here's another question. So trying to log into an account, but it keeps saying wrong username and password. How do I get those? It's saying email is not in the system. So like email when you try to reset the account, because if you call the toll-free line, we can look up your username and I think potentially also see the email that's associated with the account so that you know that information, and then you would go ahead and reset your password that way. And so that, let me put the toll-free line number. Is there another way that they can do that?
Yeah, so for Washington Health Plan Finder account issues, if you're not getting anywhere with the forgot my username or forgot my password, it's actually Washington Health Plan Finder that can help you either get your account set up or fix whatever issue you have either with your username or your password.
Awesome.
And so that phone number, I'm going to get that here.
Right, it's a lot. There's always a good phone number for everything.
Yeah. I'm not going to say I've memorized it. I've almost memorized it, but not quite. Okay. The phone number that you would need to call is 855 923 4633. I'll say it one more time. 855 923 4633. Mia looks like she posted it in the chat as well.
Yeah, because we'll add that to the website.
Yeah.
Okay. Got another one here. Right. So if I'm over 65 and don't qualify for Medicare, can I still get Apple Health? I know this is actually, I know, Roz, you've tackled this one before. I was wondering if you would like to answer it.
Mia, do you want to pull up that slide where they can apply?
Mm-hmm.
So, you would have to apply with the with the Department of Social and Health Services. And on the screen, individuals who are age 65 or older, have a disability, again, repeating, have blindness or a disability, or need long-term services and support, they can apply for Apple Health coverage, which is classic Apple Health, online, or they can call DSHS. And I believe that information is on the PIBS website, correct, Mia?
Yeah, that is. Yeah. This information and this whole every PowerPoint and presentation education event that we're going to do, the PowerPoint portion is going to go on our website so that people can have access to that.
Okay. And just for folks, again, eligibility criteria varies for each program, and that is based on income, household size, and resources. So Ari mentioned resources such as pension from back home, or I think even property, land ownership. Those are also considered as resources.
Yep, bank accounts, things like that.
And I think there's a follow up with what if I don't have a disability? If you are over 65, you would have to apply for Apple Health coverage through WashingtonConnection.org, or you can call the Department of Social and Health Services. They also have an option to submit a paper application, and that's through their local offices. And I believe, um, I mean, we can provide that information. Um, of where the local office is, because it does vary within the state.
Awesome. Thank you. Oh, there we go. All right. Any more questions in the comments? Trying to think. There, like even Renzo or Diela or Claire, what are some questions that have come up for all of you that might be good for this one?
I think it would be beneficial to kind of the student population, but I had asked if scholarships were included as income for any student that wants to apply for Apple Health.
Ooh, that's a good one. What was the answer?
Short answer, no. It's not countable income.
Well, that's good to know.
Yep.
Because that'd be a bummer if you got like a $30,000 scholarship and they're like, no Apple Health, and you're like, oh, okay. Awesome. That's a good question. Actually, there was one question that came up because I've seen this before, this chart for Apple Health for pregnant women. And like it says, it begins at a 2-person household. And Ariel and Roz clarified that a 2-person household means the mother and the baby. It's not just like the husband and the wife. It's the mom and the baby. And then if there's like it's a husband and a wife, boyfriend, girlfriend, then you'd move up to a 3-person household. So that was interesting.
Yeah, you count the number of unborn babies. So, and that's one of the questions in Health Plan Finder is how many babies are you expecting to count to help count for household size?
Yeah. Awesome. Okay. And then let's see. And then I asked, this is another question I asked the health department and was told I don't qualify and I should be on Medicare.
Well, for Apple Health programs through the Department of Social and Health Services, there are different income standards for the programs. They tend to be lower, and resources are counted. So that could be savings, property, anything that you can kind of turn into money. So I'm not sure the reason you weren't eligible, but I'm trying to think of a resource for you. You can call. I would find out why you weren't eligible. They should send you a letter saying that, give you the reason, and give you the next steps. And then if you're not eligible for, if you're over the age of 65 and not eligible for Classic Apple Health, you should go back to Washington Health Plan Finder to see if maybe you're eligible for a qualified health plan. And these folks here can help you with that application if you need to.
True. Sorry. So this question, sorry if I missed it, but which form do I use when filing my taxes? Do you mean like the form that would come from the insurance, or is this like how you should file taxes to qualify for Apple Health? It's a good question.
So one thing this time of year, if you had a qualified health plan with tax credits last year, you do need to file your taxes, and it's called reconciling. So it's making sure that you got the right amount of tax credits you were eligible for. And so to do that, you do file and complete a special form. It's the 8962 form. You use that to file with your taxes. You should, if you had tax credits at all in 2021, you should receive your 1095A form, and you use the information on that form to complete the form 8962 to file your taxes. And that for the 1095A comes from Washington Health Plan Finder, not from us.
It's true. Yeah. And then I think, Renza, maybe you know the answer to this. You can find the 1095A on the Health Plan Finder, right?
The 1095.
Mm-hmm.
On the health, you said on the health plan finder?
Yeah, when you log into your account.
Oh, yeah.
Yeah. So there's a couple ways they should send it, but you can also find it online. Okay. Any other questions? You know, I thought this was going to take longer. Must have been a really good presentation. All right, one thing that we're working on too is getting these translated, because I know that English is not everybody's language. So we'll go ahead and make sure these items are all translated. So this information for Apple Health and these presentations work for everybody, and that everybody is able to learn. And we'll post up the voiceover videos on social media when they're ready to go, and that'll give another chance for comments to come in. So if you would like to comment on those instead, we'll have the interpreters and our navigators take a look and answer those questions. So that was something that came up last time too. All right, continue to ask questions if you have any. In the meantime, we'll go over some resources. So I talked about earlier the resource page, any meeting notes and presentation slides. So like this whole presentation will be on pihealthboard.org/kofa-islander-outreach-information. And then how to apply for Apple Health. So adults, children, parents, caretakers, or pregnant individuals, you would apply at Washington Health Plan, healthplanfinder.org, or they have a mobile app, or this is the phone number for the Health Plan Finder specifically. They also accept paper submissions, or if you would like to work with a PIHB navigator, you can schedule appointments at pihb.org/Kofa Health, or call our toll-free line at 888-308-7113. And then if you are age 65 or older, have blindness or disability, PIHB is not yet right now able to help you fill out that application, but you would go to washingtonconnection.org, or you can call their phone line at 1-877-501-2233, or in person at your local DSHS office. And then I think this is the last slide. Oh, no, it's not. It's almost the last slide. But we are taking a survey. Let us know how we did during this presentation. And that survey is linked to the top of the comments on Facebook and YouTube. So if you would like to take a minute to take this survey and just let us know how you felt about this, or if you have any additional questions for next time, let us know and we'll make sure those get answered. And then finally, we turn into our future events on Facebook Live or YouTube. So today we did What is Apple Health? Our next presentation is You Qualify for Apple Health, What's Next? So we're going to start answering those questions about, when you should expect your provider one card and your managed care plan cards, and how to find a doctor, things like that. And so if you have any questions about that, you can also just post those in the survey. Oh, great. We have one more question. We'll go ahead and take that and leave this up because I like it. All right, just to help, one of those questions about the I-94 and Social Security number, people can also have their I-94s amended to accommodate their name change too, but they will need to provide the change documentation. Ooh, that's good to know. Thank you. Does somebody want to add something?
That's good information. And Joe Ennett is the Counsel General for the FSM based out in Portland, Oregon.
Oh, that's awesome. I like his profile picture.
Mm-hmm. Joe, if you want to put in your contact information, I think that would be helpful too. They can add you in as a resource for our Kofa communities.
All right. We'll wait for that. In the meantime, that is the end of the presentation and all the questions, I think. But we'll go ahead and close out with, I know it's almost Friday. I'm curious what everybody's excited to do this weekend, especially with the Super Bowl and Valentine's Day. And let's start with Deella, because I know you got plans.
Do I? I don't know, actually. Probably just homework. It's midterm season, so we have to love that.
So close. Oh. How about you, Ariel? I'm just gonna go in order how I see you guys.
Okay. For me, I just want to try and get outside. Just enjoy some sunshine. Hopefully it's not going to rain. I didn't look at the weather. Never look too far ahead.
That's true. I feel like it always changes. All right, Clara?
Okay, for me, I'm here in Walla Walla now. A little family emergency, so I'll be going back to Tacoma tomorrow.
Good to see some family, though.
Yeah.
All right. How about you, Renza? How you feeling?
I already know my day today is not good, so just rest.
I love that. And Roz?
I'm not watching the Super Bowl. My team didn't make it, but I definitely will make time. I like that you're giggling there, Deella. Yes, my Niners didn't make it, but I am definitely gonna make time for my my family this weekend.
Oh, I love it. I forgot it was the Super Bowl, but I'm really excited just to watch the halftime show. I'm one of those that I'm like, the game's on, but also the halftime show. Oh my gosh. Oh, Joe said go Rams. Well, now we know. He'll probably be really happy Monday. Awesome. All right. Well, thank you everybody for tuning in. I hope you have a great weekend. Enjoy the weather. I think it's supposed to be sunny. And thank you, Ariel and Roz, for jumping on and answering some of the questions for us. We always really appreciate it. And thank you for the team. I know you guys are all doing everything. It was a little chaotic of a day, but we all made it. And so we're very excited. And yeah, if you can, tune in a couple weeks when we go through you qualify for Apple Health. What's next? Awesome. All right. Thank you, everybody.
Thank you.
Thank you.
Thank you. Have a good night.
Bye.
Good night.